We're here in the Flying Squirrels batting cage with left-handed pitcher Nate Reed and Dr. Alex Vapp of Orthopedics and Sports Medicine. And Doctor, thanks for being here today.
Yeah, great. Thanks to be here.
Tell me a little bit about your background, where you came up through, and how you became a doctor.
I grew up in Washington, D.C. area, did my undergrad at Harvard College, and then went down south. Got tired of the cold weather. So I went to Wake Forest Med School and did my orthopedic training at Duke down in Durham, so not too far away.
Have you always been interested in sports medicine?
I have. I mean, I've played a lot of sports growing up. I played college lacrosse, and obviously had a fair amount of injuries, but the taking care of patients is what really drew me to the field.
We're going to talk about rotator cuffs today. Did you ever have a rotator cuff injury?
Luckily, no,
okay.
But I've seen a lot. So,
can you maybe show us here with lefty Nate Reed, who also hasn't had a rotator cuff injury, we're happy for that, what the rotator cuff is?
Yeah, so the rotator cuff in basics is the main group of muscles that comes over the shoulder from here and attaches out here, and it allows us to do a lot of our daily functions. Things for people out there normally, taking off their shirt, washing their hair, combing, things like that. For pitchers, it's one of the most important groups in terms of their windup. And what they usually see, and when it usually is doing its most work, is in the late phase. So as Nate brings his arm back and he's right up here, this is where his arm's rotating outwards, and those muscles are really getting most of the strain. As Nate will start his early windup phase, he's starting to bring his arm back, elevate up his elbow, externally rotate his arm there, and really start to get his legs and trunk muscles involved here. Right at this point in that late cocking phase, that's when he's really putting a lot of stress on his rotator cuff. And then as he starts to follow through, he puts a lot of stress on his elbow, his shoulder, and his forearm, and then as he whips and follow throughs and releases the ball, that's when he gets all of his velocity.
Are there some pitchers that have less stress on the rotator cuffs by the way of their delivery?
Some of their higher delivery is what the coaches usually try to teach to make sure they're taking stress off their shoulder and elbow, but part of it is their natural windup and what they've found to work for them.
It's part of the game.
It's part of the game.
So if I'm not a professional baseball player, what are some of the daily injuries that you might see in your practice?
People that are involved in recreational sports, so tennis, overhead activities, racquetball, or just throwing in the backyard with your son or daughter. A lot of times people will start having shoulder pain after that. Or people getting back into exercise for the first time. They might have taken a few months off or longer, and they're starting to do more overhead lifting and things like that.
Is that something that you see people maybe put off a little bit because they think it's just minor shoulder pain?
Yeah, I think commonly I see people come in and it's been bothering them for a few months and progressively getting worse. Usually if it's the point where it's impacting you on a daily life, so you're just having a hard time of putting dishes up on the shelf or lifting a bag up. A lot of time it starts out just as general shoulder pain. People will describe discomfort on the outside here, kind of a deep ache, and it can worsen. Sometimes there's an inciting event, so someone will feel they were lifting something and felt a pop, and then as it progresses they start to have pain at night.
If they feel that pain, what are some of the steps or some of the solutions to solving that problem?
Obviously initially you want to treat anything conservatively, so give yourself some rest, try some anti-inflammatories, ibuprofen, things like that. If it really starts to worsen, then that's when you want to come in and get checked out just to make sure there's nothing drastic at that point in time.
And if it is drastic, then there are some possible surgical implications.
We always try to do the least invasive first, so whether it be physical therapy, injections, different exercises, stretching, all that can help people get back symptomatically and try to prevent surgery. But if need be, we're obviously able to do that.
Now Nate, I don't know, maybe if you've picked up some tidbits along the way about how to avoid issues with your rotator cuff or some exercises you guys do on a daily basis.
Yeah, there's always time that we go to the trainer and do some internal, external stuff with our rotator cuff and have a good stretching regime that we can do every day with our trainer to kind of keep everything loose and get us out there every day. The league I was in before, I was able to stay at home, so I had some time to help my buddy out put some patios in, and there's not a day that we went out and started stretching before we would lift some heavy block or put patios in, but the first thing I do when I get to the field is stretch. Like I'll go roll out and do everything with the trainer, so it's kind of crazy that I'm lifting heavy block every day but don't think to stretch, but when I come to the ball field, the first thing I do is stretch.
Does that sound like
yeah, Nate's exactly right. So one of the biggest things for pitchers, and especially if I'm coming in to evaluate one of them that's been having some shoulder pain, I always want to check how they are in their flexibility. So if they haven't been staying up with their stretching, that's usually the first step that we have them work through. And then have them back off from their pitching, and then as that pain improves, they start to get back into throwing.
And for those that are, us normal folks,
yeah,
is there a way that you can kind of prevent rotator cuff injuries?
Some of it is unpreventable, but I think the biggest thing is just common sense and not trying to overdo things, especially yard work, landscaping, not trying to lift too heavy weights over your head or activities over extended periods of time. And just when your body starts to tell you it's enough, then take a break.
Sounds good, Doctor. Thanks for being here. Nate, thanks for letting us use you as a prop today.
Absolutely. Thank you.
Good.